Welcome. This webinar outlines the new opioid prescribing requirements for dentists. The new requirements go into effect January 26, 2019. The new opioid prescribing requirements relate to all phases of pain. This includes acute pain, defined as pain lasting 0 to 6 weeks in duration. Subacute pain, defined as pain lasting 6 to 12 weeks in duration. And finally, chronic pain, defined as pain lasting 12 or more weeks. The new requirements are designed to reduce prescription opioid misuse and to ensure high-quality care for all patients. Please keep in mind that the new opioid requirements go into effect January 26, 2019 and should be updated on the legislative website by the end of January. Prior to the end of January 2019, please visit the Dental Quality Assurance Commission website or doh.wa.gov/opioid prescribing. The new opioid prescribing requirements were adopted at the December 7, 2018 Commission meeting. The Department of Health website has a variety of downloadable tools and resources available for dentists and patients. This video is meant as an introduction to the new opioid prescribing requirements and will not cover all content. Please ensure you read and educate yourself concerning all aspects of the new prescribing rules. The new opioid prescribing requirements do not apply to treatment of patients with cancer-related pain, provision of palliative, hospice, or other end-of-life care, treatment of inpatient hospital patients, or provision of procedural pre-medications. In order to prescribe opioids in Washington State, dentists need to complete a one-time continuing education about opioid prescribing best practices and current opioid prescribing rules. This continuing education must be at least 3 hours long. This requirement is due by the end of the first full CE reporting period after January 1, 2019, or during the first full continuing education reporting period after initial licensure, whichever is later. One of the most important tools for dentists is the Prescription Monitoring Program PMP, which helps track all controlled substance prescriptions for every patient. It also collects information on prescribing practices and gathers data about controlled substance prescribing in the state. The new opioid prescribing requirements incorporate increased mandatory use of the PMP to improve opioid prescribing best practices. The Prescription Monitoring Program gives healthcare providers, including dentists, access to patient information before they prescribe or dispense opioid refills. The PMP allows dentists to be aware of duplicate prescribing, possible misuse, drug interactions, and other potential concerns. This tool helps dentists provide improved patient care. All dentists who prescribe opioids must register with the PMP prior to prescribing opioids in Washington State. If you are not registered with the PMP, please register at doh.wa.gov/PMP. If you have questions about the PMP or need help registering, please visit doh.wa.gov/PMP and use the link on the left navigation, registration resources and instructions. You may also call the PMP customer service line at 360-236-4806 with questions or to set up an appointment for assistance with registering. The Department of Health suggests registering as soon as possible. With the requirement changes, an influx of providers will be registering during the next several months. Dentists may delegate mandatory PMP queries to an authorized healthcare designee in line with the PMP rules. An authorized healthcare designee is a current healthcare provider licensed with the Washington State Department of Health, such as a dental assistant, dental hygienist, dental anesthesia assistant, and expanded function dental auxiliaries. Any healthcare provider licensed with the state may be designated to perform PMP queries. As outlined in the new opioid prescribing requirements, dentists must complete a PMP query prior to the first refill or renewal of an opioid prescription for acute non-operative pain or acute perioperative pain, transition from acute to subacute pain, and transition from subacute to chronic pain. For chronic pain management, a PMP query is performed at a minimum frequency determined by the patient's risk assessment. A risk assessment tool is a validated tool or questionnaire appropriate for identifying a patient's level of risk for substance use or misuse. For a high-risk patient, a PMP query must be completed at least quarterly. For a moderate risk patient, a PMP query must be completed at least semi-annually. For a low risk patient, a PMP query must be completed at least annually. In addition, a PMP check must occur for patients in chronic pain management when aberrant behavior occurs, providing acute or surgical episodic care for chronic pain patients. Dentists must document in the patient record any pertinent concerns they discover through the PMP. Please see the Department of Health's PMP webpage for more detailed information about the PMP, access to frequently asked questions, or links to instructional videos at doh.wa.gov/PMP or call 360-236-4806. Dentists must educate patients on the risks, proper storage, and disposal of opioids. This is required upon the initial prescription and at each transition phase of treatment. An example of a transition phase of treatment is when a patient transitions from acute phase to subacute phase. Acute pain is defined as pain lasting 0 to 6 weeks in duration. Subacute pain is defined as pain lasting 6 to 12 weeks in duration. Chronic pain is defined as pain lasting 12 or more weeks. In order to assist dentists and other prescribers of opioids in having important and informative conversations with their patients, the Department of Health has developed several patient education handouts which are available for download on the DOH website at doh.wa.gov/opioid prescribing. Dentists and other prescribers are not required to use the one-page handouts developed by DOH. However, they are provided as a resource. Dentists should consider alternative treatments to pain rather than defaulting to the use of opioids whenever reasonable, evidence-based, clinically appropriate alternatives exist. Acute pain is defined as pain lasting 0 to 6 weeks in duration. Acute pain may either be the result of non-operative or perioperative pain. Dentists must comply with requirements for prescribing opioids to treat acute pain by documenting the patient record, querying the prescription monitoring program and documenting concerns, not prescribing a greater quantity than needed for the expected duration of pain severe enough to require opioids, providing patient notification on opioid risks, safe storage, and disposal, and not prescribing beyond a 7-day supply for non-operative acute pain or perioperative acute pain without clinical documentation in the patient record. Pain lasting 6 to 12 weeks in duration is considered subacute pain. This period is important in patient care because it may indicate that the patient is not healing as expected. Dentists may need to further evaluate the patient's progress and whether alternative treatments may better help the patient before continuing or escalating dosages of opioids. Dentists must comply with requirements for prescribing opioids to treat subacute pain by conducting a patient evaluation and documenting the patient record, querying the prescription monitoring program and documenting concerns, educating patients on the risks and benefits for continued opioid use, considering tapering, discontinuation, or transitioning to chronic pain treatment. Dentists shall not prescribe beyond a 14-day supply for subacute pain without clinical documentation in the patient record, and documenting transition to chronic pain if planning to treat with opioids beyond 12 weeks in duration. The new Dennis opioid prescribing rules adopted on December 7, 2018 included amendments to the previous Dennis chronic pain management rules that have been in effect since 2011. Minor updates to the existing pain management rules were made to better align with the new rules sections being added. We encourage all dentists who prescribe opioids to read in detail the new requirements pertaining to opioid prescribing at doh.wa.gov/opioid prescribing. Pain lasting 12 or more weeks is considered chronic pain. Dentists must comply with requirements for prescribing opioids to treat chronic pain by conducting a patient evaluation and documenting the patient record, completing a patient treatment plan with objectives, counseling the patient concerning the risks and benefits for continued opioid use, completing a written agreement for treatment, periodically reviewing the treatment plan and querying the PMP at least quarterly for high risk, at least semi-annually for moderate risk, and at least annually for low risk patients. The new opioid prescribing requirements do not mandate that all high-dose patients need to be tapered. Dentists must assess the appropriateness based upon the patient's response and compliance with the current treatment plan. Consider tapering, changing treatment, discontinuing treatment, or a referral to substance use disorder when the patient requests such a change, there is a deterioration in function or pain, the patient demonstrates non-compliance with the written agreement, other treatment methods are indicated, patient evidence of misuse, abuse, diversion, or substance use disorder, severe patient adverse event or overdose, unauthorized dose escalation by the patient, dose escalation and no improvement in pain, function, or quality of life. Opioids shall not be prescribed with the following medications without documentation in patient record, discussion of risks, and consultation with prescribers of other medications for patient care planning or consideration of tapering. Benzodiazepines, barbiturates, sedatives, carazoprodol, sleeping medications also known as Z-drugs. When co-prescribing opioids to a patient receiving medicated assistant treatment MAT, consult the MAT prescriber or a pain specialist. Do not discontinue MAT without documentation. Do not deny necessary operative treatment due to MAT. Dentists must confirm or provide a prescription for naloxone or refer the patient to a pharmacist for further counseling and evaluation when opioids are prescribed to a high-risk patient. For patients 24 years and under, treat pain consistent with adults, but account for weight and adjust the dosage prescribed accordingly. 8 to 12 tablet supply will often be sufficient. The dentist may not prescribe beyond 12 tablets without clinical documentation in the patient record. For pregnant patients, carefully consider the risks and benefits of opioid detoxification during pregnancy. Do not discontinue MAT without oversight by the MAT prescribing provider. For patients 65 years and older, consider changes in tolerance, metabolism, and distinctive needs that occur with age. Unless exempted, consultation with a pain management specialist continues to be mandatory when prescribing more than 120 MED. The consultation requirement's purpose is to ensure the care patients receive when on high doses of opioids is carefully supervised. For more information on the exemptions for dentists, please review WAC 246-817-950, WAC 246-817-955, and WAC 246-817-960 at doh.wa.gov/opioid prescribing. Thank you for watching this webinar. For more information, please see the resources available on the next slide.